What's up, everybody? It's David. I'm your host of Highway to Health. I appreciate you being here. If you know anything about this podcast, you know we're here to celebrate the people, the organizations that are committed to improving access to healthcare, experience while getting that healthcare, and then, of course, the outcomes for our patient community. We've had the honor of talking to some great people and some great companies, and today is no different. Today, we're going to meet Priya Patel. She's the co-founder. She's the CEO of OverbookMD. And they're doing some cool things to get immediate access to the healthcare patients need and doing it in a way that, I don't know, you might even call it the Uber of healthcare. Priya?
Yeah.
Welcome to Highway to Health.
Thank you so much.
Yeah, good to see you.
Good to see you as well.
Welcome to MarketScale, too.
Yes, I'm excited.
You look good.
Thank you. So do you.
Yeah, those glasses are sharp.
Do you like them? So.
We like to have fun here, but we're going to talk about some fun things, some cool things, but also some important things.
Yes.
You know, I've been in healthcare a long time, and it seems like we've always had this conversation about why it's hard to get the healthcare you need, where to go, who to go to. It's very complicated, especially for people who aren't in healthcare. And I think you guys are doing some cool things to simplify that complexity.
Thank you.
Yeah.
Yeah.
But we start every podcast the same way.
Okay.
And share with us a healthy habit, mental, physical activity that you've built into your routine so that you stay top of your game.
So I was thinking about this today because I think everybody talks about fitness, right? I think one of the things being in a role, especially in a startup founder type of role, there's so many things going at 100 miles an hour. I mean, your mind is like, oh my gosh, I think I dropped the ball here. I did this. What's going to happen with that? So one healthy habit that I actually got from a friend of mine who has a podcast called Better You're Busy is journaling. And I know we talk about journaling, but in general, one of the things that we always need to consider, though, is most of our anxiety and stress comes from the fact that we think we have a million, literally 1 million things going on in our heads. But if you just write it down, there's probably only 10. So once you actually put it down on paper, kind of unravel some of the thoughts that are going on in your brain, I think your day just moves very, very smoothly. And that's what I do every morning. Just, a cup of coffee, me time, set the brain right, and let's go. So that's my healthy habit.
That's good.
Thank you.
Setting that time aside in the morning is, man, it's so important. I kind of have an unfair advantage. I have a long drive into the office.
Ooh.
And people are always asking, how do you do it? It's like, no.
It's the best time.
I get to do it.
Yeah.
And so putting that time aside helps me set my day, get my mind right. And then when I sit down in the chair, it's like go time.
That's awesome.
So journaling, I bet, is very similar to that.
Yes, it is. I mean, I'll also say on the flip side, there's a lot of studies that show that if your brain is going, because you've been sleeping for 8 hours, and yes, sometimes your brain is going at night, but if you've had that break to really think and you get up, guess what? It's like a computer that just rebooted. It moves 10 times faster. So just right off of that energy, you don't have to always do a morning routine. So I like to talk through some of that stuff because I've been reading a lot lately, and I like to journal whenever there's a lot in my head. But when I'm ready to go, I'm just ready to go. Let's keep moving forward. It's high energy. So
I like it. Yeah. What kind of coffee person are you?
Ooh, black, just straight black. Yeah. Not a latte, nothing. I love the flavor of great coffee. And I will say right now, I'm on the Pete's kick. So, yep.
Is that a sign that we're getting older, that we like black coffee?
No, it's a sign that we're wiser.
Mature.
Yes.
Mature.
Yes.
You can tell by our glasses.
Yeah, absolutely. Not our grays.
I'm with you. Tell us about OverbookMD. One of the best things about healthcare right now is the innovation that's happening. And we're getting closer and closer to the type of experience in healthcare that we expect really anywhere else in our lives. But with that innovation comes competition. And so I'm interested to know a little bit more about OverbookMD and how you're set apart, how you're differentiated.
I'll start by saying, what is OverbookMD, right? Yeah. OverbookMD is providing access to the best specialists within 48 hours. It is a way to have concierge access at an affordable price. And what we do is we vet all of our doctors to make sure you're not just getting any doctor or specialist, you're getting the best of the best. We want to make it extremely easy. I love the way you said it earlier. It's like Uber. Before Uber, I don't even know. I think I would have friends drop me off at the airport or how to make a few phone calls. Just like that in healthcare, you made a really good point about quality is getting better, innovation is getting better. But I don't believe there's anything out there really that's going to cater to you to ensure that you get the best of the best without actually having a concierge physician at your fingertips. So how we differentiate ourselves is very, very much so. Like if you look at our competitors such as ZocDoc, for example, they are a great platform to schedule yourself. But you don't know which doctor you're getting. You don't know, have they been vetted? You may not even know if you're getting a doctor when you go into the visit. It could be a nurse. It could be a PA. We are going to guarantee that you will see a doctor at every instance.
Almost in every other industry, and even in healthcare, we've sacrificed quality for speed. With some of the innovation that's happening, that's not always, it doesn't have to be that way.
No.
And y'all found a way to get the patient connected quickly to a doctor who's really well qualified to deliver the right kind of care.
Yes.
So how do you do it? I mean, because every time I hear of doctors, right?
Yep.
And I talk to a doctor, they talk about how busy they are, how short-staffed they are, how, they have less time with patients than they did before. So how can you find a doctor, get them connected, get them seen, get the patient seen so quickly if they are that busy?
Yeah. That's a great question. So mathematical, this is my math side that's going to come out. And my two co-founders, Dr. Blake Staub and Addison Kim, I think when looking at the statistics, there's about 20% cancellation and no-show rates for every single specialist that exists out there. And you can't control them. Patients get sick. Sometimes they don't have transportation. Life happens.
Right.
So when that happens, all of a sudden, the physician, the specialist, the doctor has a gap, especially for a lot of specialists that do procedures, for example. In their case, trying to get an appointment, they only have a couple of days out of the week that they're actually in clinic, right? So Dr. Blake Staub, he's a neurosurgeon here at Texas Back, for example. He's only in clinic a couple of days a week. So if you miss that date or that time, you're looking at literally 6 to 8 weeks. But if there's a cancellation or no-show, it's an easy way to squeeze in. I'll also talk about the fact that the front office and the business office, what they do is incredible. And I think a lot of times we forget about those behind the scenes that make things happen.
Yep.
They're calling, they're on phone calls, they're making sure that patients are screened, making sure that they have all the insurance information, right, so that way they're cleared and they don't have a huge copay towards the end. So they're doing a many different things. And so what we've done is made it extremely easy for them, even where they get an electronic request. It has all of the questions, all of the information that they need. And so then that front office and the business office is just able to efficiently schedule the patient within 48 hours.
You're touching on a really important point here, because what is good for the patient also has to be convenient and good for the provider as well, or else it's not a good marriage. And so you're hitting on something that's really important, which is the day in the life of the clinician,
yes,
the staff. So this is a value to them as well. Tell us a little bit about what you've seen there.
A lot of times if somebody calls and says, hey, can I get in today, or can you squeeze me in? I mean, they may be mixed between 100 phone calls that day, right? So who's writing that down? What information are they getting? Do they have all the information that they need? So we've created efficiency not only for the clinician, which is the physician, specialist, or doctor, and I interchange them quite a bit, because a specialist, I want to define that as well, right? In our world, a specialist is a neurosurgeon, orthopedic surgeon, cardiologist, dermatologist, or when you talk about doctors that also are specialists, such as dentists and optometrists. So we have those as well on our platform. When you look at the doctor, it's somebody that has a doctorate level degree. So I like to just make sure that from a definition standpoint,
right.
And what we do that really helps the front office is we have 5 to 6 questions that each specialist has created. So say a cardiologist, they've created 5 or 6 questions that are related to what medications are you on? Have you been told that you need to get a procedure? Have you had an x-ray? Some of the big questions that it's really important, because if you're the front office managing the schedule,
right,
you need to know which time block to put them in, right? You need to know, is a cardiologist going to need 20 minutes because this person is looking for a second opinion for a procedure, or is this somebody that's brand new that's just looking for just a visit? So this really helps the front office. It also helps the cardiologist in this instance say, hey, I want to squeeze them in today because this looks pretty emergent, because if we need to, I have some time on Thursday for a procedure. Let's get them in today.
Right.
So this really, it's a win-win-win for all parties, and communication, especially in the era of technology. Why are we using phone call, which is a patient safety issue? Why not have electronic methods to really transfer information in a very safe and effective way?
I saw something the other day about how many faxes are still being used in healthcare, and it's crazy. It's like, are you kidding me?
Yeah. Because right now, it's one of the safest ways, aside from just logging into a HIPAA very secure portal, which is what we use. But faxes are still how referrals work in this market.
Which is crazy, because I know it's kind of the traditional or the standard of secure.
Yes.
But like anybody could walk by a fax machine and pay. It still has its steps.
Yes. You're right. I think the one thing, though, is it's really hard to intercept faxes, right? So I think that's something that's done very well still. And we still see it. I agree with you.
Yeah, it's wild. But we're getting better.
We are.
So I want to talk about, let's get back to the patient. And everybody kind of understands, because we're all patients, we kind of understand if care is delayed, what kind of impact that could have on our experience and the outcome of our own health. That's intuitive. We've all probably been there. I think of dermatologist appointments. If I don't go get seen, it could turn into something I don't want it to turn into. I need to show up. I need to be there. And if I'm delayed with care, I understand the risks. But what I don't think we necessarily consider all the time is the stress then that it puts on a provider and the overall health system.
Yes.
And so, of course, we're talking about this immediate need to connect patients with physicians, but we also need to discuss what the downstream effects are when a patient delays care or has to wait too long to get the care they need.
It's funny because in a era of a lot of innovations and a lot of technology, we're getting to this point where doctors, especially post-COVID, and I would say even before, the system was stressed, right? We don't have a lot of physicians, especially specialists. There was something that was just released the other day where there's less and less primary care physicians coming out.
Yep.
There's so much more constraint on the system with processes and things like that. So what happens in those scenarios, right? As we delay care. So I'll give you an example. But first, I want to talk about if you don't see, let's say we had a patient that needed a total knee replacement and they had a cardiac clearance because of their age and complications. So they had to go get a cardiac clearance to make sure they were good to go for the surgery.
Yep.
Went and got his clearance and they found out they had a heart block. Well, the doctor that they normally see said, we can't get you in for another week and a half or 2 weeks. So in that scenario, obviously the family was very concerned.
Oh, yeah.
I think more so than the patient, because the patient's like, no, I want to just stick with my doctor. And the family's, no, we're not doing that. We need to get you in immediately. And that's where OverbookMD can help. And a lot of times, I mean, if you wait and wait, I can't predict what would happen, but we can only imagine that that's when things like the ER come in, you start going to the ER. So from a care standpoint, the patient is at high risk already, and it's, they use the word a ticking time bomb. That is literally what they're in a state of.
Yep.
But on the other side of things, if they don't have an avenue to get to a doctor quickly, they're going to go through the ER, and that costs the system financially a lot of dollars. So that's where kind of you're looking at it from both standpoints, from a care as well as a financial operational efficiency.
Like the ER has become, especially for those who don't leverage the health system often, it's almost become the default, because in that moment, you're not worried about what the bill is going to look like.
Correct.
With my kids, like, I'll worry about the money later. I've got to get them the care they need. I can't wait a week and a half. I can't wait 6 weeks. And so it's become the default, which puts obviously financial burden on the patient. But, the hospital, the health system feels it too.
Yes.
And the insurance company feels it also. The employer feels it. It's such a downstream effect when care's not provided at the right time.
Correct.
At the right place.
Yes. So I want to talk about, I've had two scenarios, and this is, in my opinion, it was pretty eye-opening. I was at an event about a month ago, ran into this really nice gal. We were talking about, just what OverbookMD is, and she was talking about her business. She just stopped and looked at me and she goes, Pri, I need to talk to you, and this might be TMI. And I said, go ahead. She's like, I'm pregnant and I'm spotting right now. And I said, okay. Okay. Have you called your OBGYN? I'm not your doctor, but I want to help you guide through this. So she said, I did, and they were booked out for a month. And I was like, wait a minute, this is your established OBGYN. She's like, yeah, they're just not available. So did you call your PCP? Yes, but they can only run a few tests. They can't run the full gamut of what I need. And so in that instance, we were able to get her in within 48 hours with one of the best OBGYNs, board certified OBGYNs in the Dallas area. However, in another circumstance, and this is something that I didn't realize it was a common issue until we started seeing the patients come through. There's another gal that was told the same thing. Her OBGYN was booked out. She had to go to the ER, was in the ER for about 3 to 4 hours waiting, and finally got an ultrasound. So an ultrasound tech came and checked everything out. She was great. The baby was great. Everything was good to go. But she also had $4,200 out of pocket.
Right.
So for her, that's not the news that she wants to go through in the stress and anxiety. But on the flip side, also for the ER, there's people that were waiting clearly for 3 to 4 hours that needed emergent help.
Right.
So that's kind of where OverbookMD comes in to say, we get you in within 48 hours, especially in these type of situations. So it's less stressful for mom and baby in this situation and the family. And then also the ER can be utilized for what it's really utilized for.
So powerful. That brings up two questions, though. How do you vet these guys? How do you vet these physicians, these clinicians? And then also, at what point can the patient engage with your platform? If David has a torn rotator cuff, but he doesn't know that yet, and he needs to go see a specialist, do I need a referral before I log into OverbookMD? Talk about at what point can the patient engage with OverbookMD and not encounter the prior auth and the referral and all of those other things that kind of have put roadblocks in front of the patient before.
This is where kind of the healthcare nerd side of us come out a little bit, right? So
let's nerd out. Let's do it.
Nerd, right? Like I just say this, I'm a pharmacist by background, right? And I've been running healthcare operations for a very long time, 16 years and 20 years solely in healthcare. And when you look at what really makes a great doctor, getting the access to that data is very difficult, right? So we decided to invest time, energy, and obviously money into this. So my co-founders and I wanted to make sure that how do we say that we have the best doctors? And so we are data backed 100%. So that's my nerd side, right? Being a pharmacist by degree, I want to make sure that we can back this up with evidence. So we pull data for every single doctor. I have an amazing data team. They obviously have created an AA program just to run a lot of data at our fingertips as we're constantly onboarding doctors every single day. We look at patient outcomes. So from a Medicare, Medicaid standpoint, there's a lot of data out there. There's also other insurance data, but we really look at that. We look at spend per patient. So how much is the doctor spending on average per patient? And we've also normalized these physicians, these doctors among their peers, right? To say, what does it look like from this zip code versus that zip code? So we've done some work there. We also look at malpractice and litigation. So is there anything going on there? Right. Because we've heard enough about Dr. Death and we are not going to, we don't want to deal with that, right? Yep. So we look at actively what is going on with their license, background, criminal checks, and any active litigations. And then the last thing we look at, but I would say one of the most important is experience. So generally speaking, when I ask a lot of patients what's their way of understanding what's a great doctor, to them it's Google reviews. But in our eyes, there's a lot more out there. So we scrub the internet, the face, anything we can get a hold of. And we have all of the experience scores available as well. So we kind of have 4-pillar approach to vetting our doctors, extremely thorough. And then we've created the Overbook Quality Index score. Okay. So if they don't meet a specific threshold, they're not on our platform. So we about 25% don't make it on our platform, just to kind of give you a rough number.
Gotcha.
Now, from a patient standpoint, getting access to these doctors, it seems, there's been a lot of questions. Do I need a referral?
Right.
Or how do I know that I can get? So we're working with an oncology group. I'll give you a good example there. For some plans, I will say yes. HMO specifically, there's a referral that's required. I think the first thing that we do is we do have a way to notify the patient that we can get you in, but it is going to take a little bit longer, unfortunately, because of how the insurance works. So we're very transparent with that process.
Yeah.
In most cases, we guide them, and I'm still on the back end a lot of times picking up the phone and talking to patients myself because I think that's a priority.
Okay.
So I will call them, I'll talk them through the process, whether it's they need a changeover, whatever their insurance requires. So we follow that process and make sure we get them the access. The other part of it is also with specialists specifically, there are questions that ask, have you been referred by a PCP? Some physicians or specialists require that information.
Yep.
So we make sure that we include that as well. And then going back to the oncology group, I think there's a lot of data and scans, x-rays, things that they need prior to booking the appointment. And I think what we're trying to say is if you have that information, fantastic. If not, the office is going to guide you and they're going to get you and they're going to pick your appointment up within 48 hours and make sure you're on the fast track instead of waiting 6 to 8 weeks in general.
Some things are unavoidable.
Yes.
You got to have them. And there's good reason for some of that stuff.
Yeah.
Not all of that stuff.
No.
But you've got to play the game sometimes. And if you're playing that game, it helps to have a coach
yes.
guiding you through the process.
I love the way you put that. That's exactly the way we're helping patients, almost coaching them through the process. And I think sometimes if you really look at a lot of these patients, and I've talked to many of the patients that have come through our platform just to check in with them and see how their experience has gone. And the number one feedback is, Priya, healthcare is so complex. The fact that you guys are just talking to us
Sure.
and walking us through this step, and the office of the physician is calling us and navigating us, it just makes a world of a difference.
Yep.
So
I noticed on your website, you have a section there for employers.
yes.
What does that mean? What does this mean for employers?
Yes. So we do have a section for employers, and I smile because, sometimes we forget how important that world is. We have a client, Greyhound Bus Lines. I'll say they've been a remarkable client, and one of their challenges is you already have a shortage of labor, you have a shortage workforce, and somebody gets injured on the job or something happens, where are they turning to? Who are they going to? And so employers in general are really interested in this, in our platform, because we're providing access within 48 hours instead of their employees they're on leave
Right.
weeks upon weeks if they get hurt or they're just sick,
Yeah.
right? So we've been able to work with them directly. In addition to that, we hear about, if you go to a lot of these conferences, the number one they talk about is access.
Yep.
You have a specific insurance plan. You have specific, different concierge type of approach to medicine. So you can do primary care or in-office clinics. There's a lot of that that's
Sure.
available. But there's only so much you can do at that point where you need to turn to a specialist to
Right.
take it from there.
Yep.
So that's kind of where we're partnering with, whether it's care navigation companies directly to employers. And we really help them kind of take care of their employees where they feel valued, where they have a choice to be employed at whatever business or company that exists in their metroplex.
I heard that like this line item for businesses, the benefits line item is the second largest line item on their
Yes.
budget sheet.
Yep.
Right behind salary, and payroll.
Yes.
And if you can provide a way to get their employees the care they need in a timely way to get them either on the right care plan or back to work, that's a lot of value for employers, and the more employees that they have,
Yes.
the bigger the value.
Well, I mean, and if you think about it, you hit the nail on the head. Benefits, it's like number 2 on their line item. You're right, of expenses, the top expenses. And if employees are waiting and they don't have access to care, where are they going to go to? The ER.
They are.
Right? Or even the urgent care.
Yep.
And I think, the
Or they don't go.
Or they don't go. That's
Which gets even worse and more expensive.
and then they're admitted. So it's kind of looking at the bigger picture. And I think I'm really impressed to see, especially in Dallas, how progressive a lot of these employers are becoming
Yeah.
with, hey, number one, we've got to take care of the people that take care of our company.
Yep.
And so we kind of go back to the old days, right, where that was part of the business.
Yep.
You want a great running business, you take care of your employees. And so that's what we're starting to see. But financially, yes, there's always a constraint. And so look at your ER visits, look at your urgent care visits or hospital admissions because we are not getting access properly.
So what's next? I mean, how do you scale this outside of the DFW, outside of the Texas region?
We're a tech company technically, right? So I think that's what's really exciting is that we can take this and plant this wherever we want to go. The part that takes a little bit the longest is finding the best of the best doctors. And we kind of talked about how much time and energy we invest in finding the best doctors. But I would say once we find a great, either a hospital system that wants to partner with us or a large practice, there's some high quality practices that exist that are diverse in their specialties.
Yep.
That's all that it takes, and everything else is a go from us.
Oh man, there's such an opportunity because it's expensive for everybody when it goes wrong, when it goes poorly. And unfortunately, healthcare is a business. And if you can help save money, if you can help, like these doctors that have a 20% cancellation, that's lost revenue for that practice or for that system.
Yes.
And so you can help them save money, you can improve patient outcomes, you can grow bottom line.
Yeah.
But yeah, the data when vetting these physicians, I would imagine, is the toughest part because they're protective of that stuff.
Yes, I would say, and doctors have gone to school for a very long time to do one thing is to care for patients, and obviously there's many other reasons and benefits, but for them to catch up every time they lose an appointment, there's several statistics that show that sometimes they will never catch up unless because of they're in the procedure rooms or ORs a lot of times. So it's that gap could have cared for someone, could have had access for someone that really needed that appointment. And so that's where we just plug them in seamlessly.
If, for the people watching and listening, if they could remember one thing from our conversation, what's the one takeaway you want to leave them with?
I would say don't wait for your health care. At the end of the day, I mean, we don't wait for many other things. We don't wait we need toilet paper, well, let's get it right now. Yeah. We need groceries, let's get it right now. I need to, get a ride to the airport, I need it now. But why are we waiting on healthcare? Yeah. That's the number one thing that we should be taking care of. So don't ever wait on your healthcare needs. If you're not feeling right or you have a little bit, your body is telling you something, that's when you need to just take action. Because if you wait on your healthcare, if you sleep on that, I mean, I don't know. I just hate to hear all the things that come from that. So, yeah.
Yeah, health is everything. Without it, nothing else matters.
Yes.
And, with a family, I've never realized that more than, I realize it now. And so, for those listening, speed doesn't mean a lack of quality, especially when working with a great partner like OverbookMD. Don't wait on your healthcare because you don't have to. And thank you for coming on and talking about this important topic, access, experience, and outcomes. You address all three. And it was an honor to talk to you.
Thank you so much. It's been an honor. And I love the work that you're doing in healthcare because we need more of it every single day. I think healthcare needs a strong voice. So thank you for all that you do.
Thank you.
Yeah.
Thank y'all.